Advocacy efforts often focus on awareness and improvements in policies and services. Our advocacy plan specifically focuses on the development of services to prevent self-harm and suicide in students attending colleges in the University of Texas system. Our plan details the background of mental health issues in college students as well as the relationship of this issue with the external environment. Our plan aims to develop a detailed framework for expanding mental health services on campus and obtaining federal funding for these costs. Our public health issue is self-harm and suicide among college students. Mental illness is a condition that affects an individual's way of thinking and feeling. It also affects their mood and behavior. The suicide rate for young adults from ages 15 to 24 was at 14.45% in the United States in 2018. About 90% of individuals that commit suicide had a mental disorder that could have been diagnosed with proper treatment. For college students, there are a lot of changes happening. They are transitioning into college and could experience stress due to new social environment, academic demands, and separation from family and friends. These changes can cause an individual to feel lonely and anxious. The Substance Abuse and Mental Health Services Administration is a federally funded agency that provides resources. In 2005, the United States spent $135 billion on treatment for mental health and substance abuse. Mental health can have an adverse effect on the economy. Mental illness accounts for over 50% of the worldwide economic burden attributable to non-communicable diseases. Suicide happens due to different natural, mental, relational, ecological, and cultural impacts that associate with each other. It also occurs due to unfavorable exposures such as physical and psychological. Addressing mental illness with today's technology makes outreach efforts more effective and helps reach audiences in different manners. Recent advancements in technology have given many the ability to promote mental health issues. Our advocacy initiative goal is to gather funding through various grants, private and public, that will be used to further expand mental health services to students that attend any schools within the UT system. We will seek funding through various grants using application portals such as Substance Abuse and Mental Health Services Administration. Some examples of grants that we are seeking are Protection and Advocacy for Individuals with Mental Illness and Community Health Services Block Grant. We plan on using the technology resources available to us, such as the National Mental Health Services Survey, so that we can see trends and needs among the students that would otherwise need to be asked in our own surveys. The outcome we hope to achieve would be to eliminate barriers such as financial hardships for students by obtaining grants in hopes of expanding access to mental health services on campuses in the UT system. Our initiative is important in eliminating barriers and expanding access to mental health services for students within the UT system. In doing so, students may be encouraged to seek help and not have financial barriers preventing them from doing so. Our budget covers expenses that are classified as personnel cost, travel, equipment, and other, which is our emergency fund. The total for our budget is $205,300. Our first recommendation is that a meeting take place between university officials and mental health care specialists to determine what resources are needed to improve student mental health. Our second recommendation is for the formation of gatherings for students, staff, and faculty to discuss mental health. Our last recommendation is for the UT system to provide students with an introduction to all the mental health services that are available to them.